And so once again, we're being visited by Mr. Marcos Mejia, who is here to update us on what's going on with COVID, the vaccine, the new, research that is coming out, the new pills that apparently are being developed, and then the support for people who are renting and who are behind on their payments. So thank you again for making the time, Senor Marcos Mejia, and please take it away.
You're welcome, Rafael. Well, I'd like to start with talking about vaccination. As of today, we have applied more than 700,000 doses of vaccine, and this is a monumental achievement achieved in less than 10 months since the vaccines began rolling out last December. This week, we have reached 77.3% of the country's eligible population as fully vaccinated, and another 7.6% is partially vaccinated. Thus, when we have these two groups together, we have that 85% of the eligible population, which is 12 years and older, is either fully or partially vaccinated. The county's top priority remains administering the first and second doses so that more people are fully vaccinated and protected. Even with newly approved booster shots for certain groups, we will talk about it in a minute. But for now, more than 367,000 residents in the county have received at least one dose. That's a lot of people, that's a majority, but we still are orbiting in that 30% of the population, including two aspects: the ones that are not vaccinated yet, are hesitant or resistant it, and the ones that are not eligible yet. So that's a component of that 30% that we still have to worry, and that at the level that we have with the virus spread, which is still the widespread level, this 30% of the population is very susceptible of infection, and also the vaccinated people, as we know in the post-vaccination cases. We know that all the cases are coming to a low after the wave that we have of COVID in the summer, but the winter is coming. So we're gonna continue focusing on first and second doses, even when we have the third round of vaccines available for Pfizer by now. So there is a steady progress that is being made each week. Each week, another 1% of the eligible population is fully vaccinated. The county immunization clinic page is constantly updated. Pop-up calendars make it easy to see which clinics are operating each day, and therefore we invite you again to visit our website, socoemergency.org. The COVID test also, the demand for them continues to be strong, and this continues to create some degree of difficulty for people to find easily and fast a place where to get the test. I hear from people that calls us that they're going to our website to see all the many options that are across the county, and then they pick something that is convenient for them and closest to them. So please go to socoemergency.org/test to find the many options that are there. So the volume of tests continues to increase, and it has more than doubled since July 1st. The 7-day average holds steadily at around 3,000 tests per day. Residents also can call the hotline at 707-565-4667 if they speak English, or 565-4701 if they speak Spanish. Now I'd like to give you a little bit more of details about the boosters injections. We began talking about this subject last week. The FDA, Food and Drugs Administration, recently authorized booster shots for some people who received their second dose of Pfizer vaccine at least 6 months ago. The Centers for Disease and Control, or CDC, specifically said that Pfizer recipients aged 65 and older and people aged 50 to 64 with certain underlying medical conditions should receive a booster shot. Those vaccinated with Pfizer who live in a long-term care facility, such as nursing homes, should also receive a booster shot. People aged 18 to 49 who are at high risk of severe COVID-19 due to certain underlying medical conditions may receive a booster shot based on their individual benefits and risk. People ages 18 to 64 who are at increased risk of exposure and transmission due to their work may receive a booster shot. This includes healthcare workers, first responders, teachers, postal service workers, and agricultural and food workers. To obtain your reinforcement, the county recommends that eligible residents use myturn.ca.gov to make an appointment. For those covered through one of our major medical providers, such as Kaiser, Sutter, or Providence, the county encourage you to contact your primary care physician to determine if you are eligible for a booster and to schedule an appointment. The underlying medical conditions that qualify for a booster shot are hypertension and heart disease, diabetes or obesity, cancer or blood disorders, weakened immune system, chronic lung, kidney or liver disease, dementia and certain disabilities, pregnancy, smoking, either if it's a current or former smoker. Now I'd like to give you an update on the start of the face-to-face school. Or the county, in collaboration with Sonoma County Office of Education, better known as SCO, is implementing measures to keep our schools as safe as possible with the resumption of in-person instruction. There have been 515 cases of COVID-19 as of today in county schools since classes began in August. Of these cases, 464 are students and 51 are staff members. So this problem continues. The majority of cases are occurring in primary schools and secondary schools. We also have a new ordinance from the governor. California will enact the nation's first coronavirus vaccination mandate for school-aged children, Governor Newsom said on Friday. The goal is for all 7 through 12th grade students to be vaccinated by next fall, once the vaccines gain final federal approval for ages 12 and older. The Pfizer vaccine is administered under the emergency authorization for children 12 to 15 years of age. The state will require students in kindergarten through 6th grade to be vaccinated once the final federal approval arrives for children 5 to 11. On the other hand, Johnson & Johnson has asked authorization for the booster vaccine. And so Johnson & Johnson asked for federal regulator last Tuesday to authorize a booster vaccine for adults, becoming the 3rd vaccine manufacturer to do so. The company said a second injection of its vaccine about 2 months after the first one significantly increases protection to 94% against moderate to severe diseases. The Johnson & Johnson vaccine for now is a single dose. Last month, the FDA authorized boosters for many recipients of Pfizer, as we know, and Moderna is seeking authorization for inoculation boosters. This may happen on October 16 for both Moderna and Johnson & Johnson. Now, there are 2 different treatments. There's an antiviral drug called Effective that would be the first pill to treat COVID. And the company is called Merck. And they said on Friday last week that its antiviral pill to treat COVID was shown to reduce the risk of hospitalizations and death by about 50% when given to high-risk people at the onset of their infections. Merck, citing strong clinical trial results, said it would seek emergency FDA clearance for its drug, known as molnupiravir, as soon as possible. The pills could be available later this year. Merck's drug will be the first pill to treat COVID-19. This drug has the potential to reach more people than the antibody treatments that are widely used in the United States for high-risk patients. The White House official welcomed Merck's announcement, but also noted that antiviral pills are not a substitute for more Americans getting vaccinated or being vaccinated. The other product comes from AstraZeneca that is also seeking approval for this one is for an antibody treatment to prevent COVID. This is for prevention. So AstraZeneca has asked the FDA as well to grant an emergency authorization for a long-acting antibody treatment to prevent COVID-19 in people at high risk for the disease. If authorized, it would become the first preventive treatment of its kind available in the United States, the company said last Tuesday. The company said that the treatment reduced the risk of COVID symptomatic by 77% in a trial in which most patients had other conditions that put them at a higher risk for serious illness or did not produce enough antibodies after the vaccination. AstraZeneca said that the treatment could be used in conjunction with vaccines in people with weaker immune system, and all the conditions that I was mentioning earlier are included as potential eligibility for these patients. And finally, I'd like to give you an update about the Emergency Rental Assistance Program. I'd like to remind the people who listen that Sonoma County has expanded the financial support available to renters and landlords through the Emergency Rental Assistance Program. The easiest way to find more details is calling 211 or visiting socoemergency.org /ERAP, that's ERAP, where they can find more information and how to find a community-based organization that can assist them with them. 32 million in state and federal funds have been made available to the county, with another allocation of 17 millions, bringing the potential amount to 49 millions that are available. 14.5 millions have been committed in Sonoma County as of last week, compared to 11.4 million in mid-September and 5 more millions at the end of July. Not all of the money has reached the tenants. 1,000 families have received aid, and there are 2,252 applications that are being processed. The average amount of rent relief per application is $9,626. $9,626 is what I mean. The county is intensifying its efforts to make eligible residents aware of the program. Requests for help have increased in the last 3 weeks. A state moratorium of most evictions ended on Friday, October 1st. Sonoma County tenants who have not paid the rent during the pandemic are still protected from eviction, according to county attorneys. Under a countywide eviction ban, local tenants cannot be evicted for COVID-19 related rental debts that accrue through September 30th. However, starting October 1st, non-paying tenants can no longer be protected from eviction unless they have already applied for emergency rental assistance. Past unpaid rent protection will last until the local moratorium expires, either June 30th in 2022 or 60 days after local officials declare that the county pandemic emergency is over, whichever occurred first. And that concludes my report.
And I appreciate, as always, that you bring so much information and the latest updates. And I look forward to our next conversation. Entonces, gracias, señor Mejia, for taking the time and being with us. And I look forward again to next week when you'll have much more information for us.
I'll be here next week for sure.
Thank you.
Have a good weekend.
Bye-bye.
Bye.